Now let's start saying that the neck pain is becoming increasingly common through the world. This is a considerable common, or it has a considerable impact for individuals, families, also the communities, healthcare centers, and also the healthcare systems. So it is important to know that it happens when a nerve root is compressed or irritated. This is going to be, or this is going to cause some pain, numbness, and also weakness. And all those symptoms are going to be irradiated to the shoulders, the whole arm, including the hands. Also, I can say that it is a really common condition that it can be treated by different kind of techniques. In this case, we are going to focus on the cervical Mackenzie technique that is going to help us to decrease that kind of pain. This because right now some studies are showing up that between the 10 and the 21% of people develop the neck pain each year. This especially for people that work in an office, also in front of the computer. And between or the 65% of that people and also the ones that make use of those techniques can recover from those kind of symptoms. However, also it is important to know that the neck pain becomes chronic, causing more difficulties for the population. And in most of the cases, it can be treated by using some neurological methods. But as I mentioned before, we're going to be using the Mackenzie technique in order to help the patients to control that kind of pain and to make sure that they're going to have a different lifestyle that is going to help them to be more active without any kind of situation that can compromise the develop of the daily activities.
In this study, we focused on understanding how the specific exercise can help people with a particular type of chronic neck pain. To make sure we were studying a consistent group, we have very specific criteria for who could participate. First of all participants had to have pain that had lasted for the last 3 months. This pain was located in the area between the base of the skull and the top of the shoulder blade. Importantly, their pain had to be by things like holding their neck in the certain positions, moving their neck, or even when the muscles in their neck were touched. Beyond just having the pain, we also looked at how severe it was. Participants needed to rate their pain intensity as 3 out of 10 or higher on a pain scale. We also considered how much the pain was affecting their daily life, measured by a score of 10 out of 100 or greater on the Neck Disability Index. Another case charismatic was their posture. We included people who had a forward head posture, where their ear was positioned significantly in the front of their shoulder, more than 5 centimeters. Finally, we use a specific system to classify their neck pain, called it the Mackenzie system. Participants have to be diagnosed with a specific type of neck problem that responds to extension movements, meaning movements that involve bending the neck backward. However, it was equally important to exclude people who had other conditions that could be causing the neck pain or that could make the exercise unsafe. We excluded anyone with serious spinal problems like tumors, inflammatory joint disease, damage to the spinal cord itself, instability in the upper neck, dizziness related to the neck, or problems with blood flow in the neck arteries. We also excluded people with nerve root problems like radiculopathy, which causes pain to radiate down the arm. Additionally, anyone with a history of neck injuries like fractures or who had undergone neck surgery was not included. Pregnant women were also excluded. Finally, we excluded individuals with a body mass index BMI over 30. This was to ensure we could accurately observe the neck muscles during our measurements, and we also excluded anyone who couldn't perform a specific neck movement test, the chronic cervical flexion test, at a certain level. So as you can see, the people in this study had a very specific type of chronic neck pain, which helped us better understand the effects of this exercise for this particular group.
Weakness of the deep neck muscles. One of the first things is weakness of the deep neck muscles, such as the longus colli. These muscles stabilize the cervical spine from weakness, but in the people with chronic pain, they are underactive or fatigued asleep. Compensations with superficial muscles. As the deep muscles don't work properly, the body needs to compensate with larger muscles, such as the sternocleidomastoid or scalenes. This creates more tension, inefficient movement, and sometimes more pain. Forward head posture. Another common sin is forward head posture. It's easy to recognize the ear is forward of the shoulder. This is measured by the craniovertebral angle, and when it's less than 55 degrees, it indicates poor postural alignment that may be related to pain. Pain upon movement or touching the neck. This occurs because there are sensitive structures and active muscle contractures. Functional disability. Finally, this pain affects daily life. This is measured using a questionnaire called the Neck Disability Index, which showed moderate evaluation in the study.
Symptoms and chronic neck pain, persist pain lasting more than 3 months in the area between the superior nuchal light and the spine of the scapula, and increases with sustaining neck position, cervical movements, or palpation of the cervical muscles. Radiating radicular pain, pain originating in the neck and radiating to the shoulder, arm, forearm, or hand, depending on the level affected. The pattern follows the corresponding dermatome. Paresthesias. Abnormal sensations at the tingling, burning, or pins and needles in specific areas of the arm or hand. Sensory deficit, discrete or lost touch, pain or temperature sensation in dermatomal distribution. Muscle weakness, localized weakness in the muscles innervating but inaffecting root, mymotome. Decreased or absent reflexes, bicipital, C5, C6, triceps, C7, or styloradial, C6 reflex. And finally, a functional limitation.
The Mackenzie cervical technique is a therapeutic exercise for chronic neck pain that involves neck retraction, starting position, and sit upright with your shoulders relaxed and spine aligned. Look straight ahead, neck retraction, pull your chin back as if creating a double chin without tilting your head up or down. Hold it for 2 or 3 seconds. The overpressure, once your chin is retracted, use your hands to gently push your chin further back, slightly increasing the retraction. Hold this pressure for 2 or 3 seconds. The repetitions and relax and repeat the retraction with overpressure 10 times per set. Perform 6 sets a day, roughly every 2 hours. And the progression, if the pain improves, you can add neck extension at the end of the retraction. Look slightly upward while keeping your chin retracted and apply gentle overpressure with your hands.
Okay, now we're gonna go to explain the first exercise for this McKinsey's technique. So in this case, what we're gonna do is cervical retraction. Basically, you can do it sitting or also standing up, and also you need to keep your back straight. So first off, I'm gonna give the explanation about this, and then I'm going to execute the movement. So sitting or standing up, what you're going to do is that you are going to pull back your head without tilting, and it is like when you try to do a double chin. And after that, once your head is closer to the back, you are going to keep the position for 5 seconds, and then you're gonna relax. And after that, you're going to repeat this exercise between 10 to 15 times, and that would be all. So the main goal here, it is to correct forward head posture, also to restore the normal curvature of the cervical spine, and finally you're gonna relieve tension in the muscles at the back of the neck. So as I told you before, right now let's go with the execution. So with the back straight, just like this, you are going to have the posture, but also you are gonna make sure that you are breathing. So you have to control your breath. So first off, you're gonna breathe in and you're gonna pull back your head like this. Here you have to keep the position for the 5 seconds, and then you're going to relax it. Coming back to the neutral position. By doing this between 10 to 15 times, you're gonna be working on the correct posture of the cervical spine, and that's gonna be for the first exercise.
Net lateral tilts. The starting position, sit up right, shoulders relaxed, spine aligned, looking forward. Lateral tilt, gently tilt your head one side, bring your ear toward your shoulder without rotating or leaning forward. Hold it for 2 or 3 seconds under pressure. Use your hand to gently pull your head further towards your shoulder, increasing the stretch slightly. Hold it for 2 or 3 seconds. The repetitions, it's an relax and repeat 10 times per side per set, and perform 6 sets daily, roughly every 2 hours. The progression, if pain improves over pressure slightly or at a slight neck extension at the end of the tilt.